Are you preparing for a care assistant interview? This video will guide you through 22 of the most frequently asked questions in such interviews and will provide comprehensive answers to ensure your success. 1. What motivated you to pursue a career as a care assistant? I was deeply inspired by my grandmother's caregiver when I was young. Seeing her compassion, patience, and dedication to helping someone else, especially someone so near and dear to me, left a lasting impression on me. I've always been a person who enjoys helping others, and I thought that this would be a great way for me to contribute to society. My personal experiences coupled with my inherent desire to help made me realize that a career as a care assistant was a perfect fit for me. 2. Can you describe your experience working with elderly or disabled individuals? In my previous role as a care assistant at XYZ nursing home, I worked primarily with elderly residents, many of whom had varying degrees of disabilities. My tasks ranged from assisting with personal hygiene and mobility to providing companionship and emotional support. I have also had experience working with individuals suffering from dementia and Alzheimer's disease, which requires a different set of skills and understanding. It's been a rewarding journey, knowing that my role plays a part in improving their quality of life. Every single day, I learn something new from these individuals, and it's been a humbling experience. 3. How do you ensure the dignity and privacy of the people you care for? In the caregiving profession, respecting the privacy and dignity of clients is of paramount importance. One way I do this is by always knocking and seeking permission before entering their personal space. I also maintain their dignity by involving them in decisions that affect their daily routines, allowing them to maintain a sense of control and autonomy. For instance, I discuss with them their preferred timing for meals and baths. I ensure their privacy during personal care activities by closing doors or using screens. I also make sure to store their personal information safely and not to discuss it with anyone without their explicit consent. 4. What do you believe are the most important qualities for a care assistant to possess? A care assistant should have a variety of key qualities. First and foremost, they should be compassionate, as they are dealing with individuals who may be in difficult and vulnerable situations. They should be patient, understanding that the individuals they are caring for may require time to perform tasks or communicate their needs. They should also have good communication skills, enabling them to effectively interact with the individuals they care for, their families, and other healthcare professionals. Lastly, they should be respectful, ensuring that they uphold the dignity and privacy of the individuals they are caring for at all times. 5. How do you handle stressful situations in a caregiving environment? Stressful situations are inevitable in a caregiving environment. My approach is to remain calm, think logically, and take immediate action. I ensure that I understand the person's needs and preferences and handle the situation with empathy and patience. If the stress is due to a health issue, I take necessary medical steps, while keeping the person's comfort in mind. In case of behavioral issues, I use effective communication and understanding to handle the situation. I also ensure to take care of my mental health, as it's essential for efficient caregiving. 6. Can you walk me through your typical routine when assisting a client with personal hygiene? Assisting a client with personal hygiene begins by ensuring a warm, safe, and comfortable environment. I start by gathering all necessary supplies like soap, towels, and a basin of warm water. Next, I gently explain the process to the client, seeking their consent and involvement wherever possible. Protection of the client's modesty and dignity is paramount, so I always cover them with a towel, exposing only the area that needs cleaning. I begin with the face, then proceed to the upper body, the lower body, and finally, the back. After washing, I dry the client thoroughly, moisturize their skin if necessary, then assist them in dressing up. It is important to make the process pleasant and comfortable while ensuring the client's privacy and dignity are respected. 7. How do you build trust and rapport with new clients? Building trust and rapport with new clients is crucial in my role as a care assistant. I begin by always being punctual, reliable, and consistent, as these attributes contribute to the trust-building process. I also make an effort to learn about the client's personal preferences, hobbies, and interests, as this allows me to engage in meaningful conversations with them, helping to foster a sense of connection and understanding. I always make sure to communicate clearly and openly, especially when it comes to explaining care plans and procedures. I believe that transparency in communication not only helps to alleviate any fears or concerns that a client might have, but also allows them to feel more involved in their care. I also maintain a respectful and professional demeanor at all times, treating each client with kindness and dignity. I strive to be patient, empathetic, and understanding, especially when dealing with clients who may be dealing with physical or mental health challenges. I understand that trust and rapport aren't built overnight, but by consistently demonstrating these qualities, I believe I can earn the trust and respect of my clients. 8. What strategies do you use to communicate effectively with clients who have difficulty speaking or hearing? Communication with clients who have speech or hearing difficulties is a fundamental aspect of my role as a care assistant. For clients with hearing impairments, I ensure I am facing them when speaking, using clear and concise language while also incorporating visual aids or gestures where appropriate. In instances where clients have speech difficulties, I encourage them to communicate in a way that is comfortable for them. This could be writing, using sign language, or through the use of communication apps. Patience, active listening, and understanding are key aspects in these interactions to ensure effective communication. 9. How do you stay organized when managing multiple clients' needs and schedules? In a profession where attention to detail and time management play a critical role, staying organized is the key. I use digital calendars and apps to track appointments, medication schedules, and other tasks for each client. I also set reminders to ensure no task is overlooked. It's vital to prioritize tasks based on their urgency and importance, and adapt to changing circumstances and needs. Regular communication with each client helps me adjust schedules and plans as necessary. I also keep detailed notes and records to ensure continuity of care and track progress. 10. What would you do if you noticed signs of abuse or neglect in a client's home? In such a scenario, my first step would be to ensure the immediate safety of the client. I would then document any signs of abuse or neglect I witnessed with as much detail as possible, including dates, times, direct quotes, and any physical evidence. Reporting this to my supervisor would be my next course of action, adhering strictly to the organization's protocols and guidelines. It's essential to involve the appropriate authorities or social services to ensure the client is protected and their rights are upheld. The welfare of the client is always my top priority, and I am committed to taking the necessary steps to ensure their safety and well-being. 11. How do you maintain proper infection control practices in your daily work? As a dedicated care assistant, I ensure infection control practices are adhered to by implementing a stringent hygiene regimen. This involves wearing protective clothing such as gloves and aprons when necessary, and washing my hands thoroughly before and after contact with each client. I also promote cleanliness in the client's environment by regular cleaning of surfaces and items that are frequently touched. In terms of waste disposal, I follow proper procedures for disposing of used materials, especially those contaminated with bodily fluids. Additionally, I am cautious when handling food or medication to prevent cross-contamination. I constantly stay updated with the latest infection control guidelines to ensure I am providing the safest care possible. 12. Can you describe a challenging situation you faced with a client and how you resolved it? In my previous role as a care assistant, I was working with a client who was particularly resistant to any form of help. This client had always been independent, and the loss of autonomy was frustrating for him. He would often refuse to eat or take his medication, which was a serious concern for his health. I knew that I needed to handle this situation with sensitivity and compassion. I began by trying to understand his perspective, acknowledging his feelings of frustration and loss. Gradually, I managed to build a rapport with him, engaging him in conversation and showing an interest in his life. Over time, he started to open up more and became less resistant to receiving help. I made sure that I respected his independence as much as possible, allowing him to do things for himself whenever he was able. This experience taught me the importance of patience, empathy, and respect when dealing with challenging behaviors. 13. How do you promote independence while still providing necessary assistance to clients? As a care assistant, I understand the importance of promoting clients' independence. I do this by involving them in decision-making processes. This includes daily routine choices, like what they'd like to eat, wear, or do for leisure. I also encourage them to participate in tasks they can safely manage, even if it's just a small part of it. This can act as a confidence boost while still ensuring they get the assistance they need. I also respect their space and privacy, and only intervene when it's essential, or if they request for help. I find that open communication is key. I always ask for their preferences, listen to their concerns, and explain why certain actions need to be taken. This makes them feel acknowledged and considered. It's a balancing act of giving support and nurturing independence. In case of physical activities, I offer support, but allow them to lead the process. This way, they still feel in control of their actions. This respect for independence, combined with necessary assistance, provides a healthy environment for the client. This approach has worked well in my experience, and the clients appreciate the autonomy and respect they receive. It helps to maintain their dignity and improve their self-esteem. 14. What experience do you have with medication management for clients? In my previous role as a care assistant, I was responsible for managing medication for several clients. This involved understanding the doctor's prescriptions, organizing the medication in a weekly pill box, and ensuring that the clients took their medication at the correct times. It also required me to monitor the clients for any adverse reactions to the medication and to report such incidents to their doctors immediately. This experience has made me vigilant and detail-oriented, and I am aware of the importance of medication management in maintaining a client's health and well-being. In several instances, I have also liaised with the client's pharmacies to ensure timely refills of their prescriptions. I understand that each client's medication regimen is unique and requires careful attention to detail, and I am comfortable in carrying out these responsibilities. 15. How do you handle emergencies or unexpected health issues with clients? As a caregiver, handling emergencies or unexpected health issues with clients are inevitable scenarios. In such situations, I remain calm and composed, prioritizing the immediate safety of the client. I am trained in first aid and CPR, and I am able to apply these skills when necessary. I also have a good understanding of all my clients' medical conditions, which allows me to identify when something is wrong. I immediately contact medical professionals and closely follow their guidance, while keeping the client as comfortable as possible. I promptly inform the family and my supervisor about the situation. I believe that preparation is key in handling emergencies. Therefore, I ensure all relevant emergency numbers are easily accessible and regularly review the emergency plans for each client. 16. What techniques do you use to lift and transfer clients safely? In my role as a care assistant, I prioritize safety above all else. This is particularly critical when lifting and transferring clients. I adhere strictly to proper lifting techniques, ensuring my legs, not my back, take on the majority of the weight. This practice safeguards both my health and the client's. I also use assistive devices like Hoyer lifts, transfer boards, or gait belts when necessary. If the client is capable, I encourage them to assist in the process, promoting their independence and engagement. It's crucial to keep communication open during these procedures, so the client knows what to expect and feels secure. The specific technique used varies depending on the client's health condition, size, strength, and level of mobility. I always assess these factors and consult with other healthcare professionals involved in the client's care to determine the safest and most comfortable method of lifting and transferring. 17. How do you approach working with clients who have dementia or Alzheimer's disease? In dealing with clients who have dementia or Alzheimer's, I approach with patience, compassion, and understanding. I am aware of the emotional and mental challenges these individuals face, and I strive to create an environment that is comforting and secure for them. I use simple, clear communication, repeating myself if necessary, and always ensuring I have their attention before I start to speak. I also use visual cues to assist with understanding. I aim to keep a routine to provide structure and familiarity. Additionally, I make sure to keep their family members updated on their condition, offering them support as well. I keep myself informed about the latest research and advancements in managing these conditions to provide the best possible care. 18. Can you describe your experience with meal planning and preparation for clients with dietary restrictions? My experience with meal planning and preparation for clients with dietary requirements is quite extensive. I have worked with clients who require low sodium, gluten-free, diabetic-friendly, and other diet-specific meals. I always ensure to consult with a dietitian or the client's doctor to understand their dietary needs accurately. I then create a weekly menu plan, taking into account the client's preferences and nutritional needs. During preparation, I am careful to maintain hygiene and I always verify that the ingredients are safe for the client's consumption. I am also flexible and willing to make adjustments based on the client's feedback or changes in their health condition. 19. How do you maintain a positive attitude in a potentially emotionally draining job? Maintaining positivity in this type of work relies heavily on perspective. I understand that my role as a care assistant has its ups and downs, but the reward of helping others outweighs any challenges. I make sure to take care of my emotional health by engaging in stress-reducing activities outside of work such as reading, exercising, or spending time with loved ones. Acknowledging and addressing any feelings of emotional exhaustion is important. I also surround myself with supportive colleagues and seek their advice when needed. It's all about balance. 20. What do you do to ensure clear communication with your supervisors and other care team members? I recognize that effective communication forms the backbone of successful caregiving. To ensure clear communication with my supervisors and other care team members, I usually utilize different methods. Firstly, I maintain regular and open channels of communication, including daily briefings or meetings to discuss any changes or concerns about our clients. Additionally, I use written communication methods such as emails and detailed reports for important updates. I also take the initiative to ask questions if something is unclear. I believe that staying proactive in communication not only helps me perform my duties effectively but also supports the overall team's functioning. 21. How do you handle conflicts or disagreements with clients or their family members? As a care assistant, I handle conflicts or disagreements by keeping calm, listening attentively, and expressing empathy. It is important to understand the concern from their perspective, so I always make sure to ask open-ended questions. I aim to find a solution that satisfies all parties, ensuring that the client's needs are prioritized. I believe having clear communication is key to resolving any disagreements and maintaining a positive relationship with the client and their family. I also make sure to discuss any persistent issues with my supervisor to seek guidance if needed. 22. What steps do you take to maintain your own physical and emotional well-being in this role? In this demanding profession, it is essential to prioritize self-care. Daily physical exercise plays a crucial role in my routine, as it helps keep my body strong and my mind clear. This not only enhances my capacity to provide quality care but also reduces the risk of injury on the job. On the emotional level, I find it beneficial to have an outlet for stress. This may include talking with supportive colleagues, practicing mindfulness techniques, and taking short breaks when necessary. I strive to maintain a balanced diet and ensure adequate sleep, as these are vital for both physical health and mental resilience. I also understand the importance of setting professional boundaries. While I am committed to my clients, it is necessary to separate work from personal life to avoid burnout. Regularly investing time in activities that I love, such as reading or spending time with loved ones, helps me recharge and return to work with a fresh perspective. Lastly, I believe in continual learning and personal growth. Attending relevant training and workshops enhances my professional skills while also providing a sense of accomplishment and purpose. In this way, I ensure my well-being while effectively performing my caregiving duties. It's essential to remember that besides the technical skills, interviewers are looking out for a compassionate nature and excellent interpersonal skills. So, articulate your answers to reflect these aspects. Don't forget to like this video and hit the subscribe button for more such valuable content. Good luck with your interview.